Okay, question. What's the difference between preeclampsia with severe features and HELLP syndrome? Let's talk about this. Okay, let's talk about the diagnosis of preeclampsia with severe features. This is when you have a systolic blood pressure, top number, greater than or equal to 160, and diastolic blood pressure, bottom number, greater than or equal to 110, on 2 occasions, at least 4 hours apart, while the patient is on bed rest. You can also have symptoms of CNS dysfunction, like new-onset cerebral or visual disturbances like photopsia, scotomata, cortical blindness, retinal vasospasm, and or severe headache, or headache that persists and progresses despite therapy like with Tylenol, and it can't be accounted for by an alternative diagnosis like a history of migraines or something like that. Next, liver or hepatic abnormality. Impaired liver function, not accounted for by another diagnosis, characterized by elevated AST or ALT greater than 2 times the upper limit of the normal range, and or severe persistent right upper quadrant or epigastric pain, unresponsive to medications, and not accounted for by another diagnosis. You can have a platelet count, again, same as preeclampsia without severe features, of less than 100,000, and then kidney function impairment, serum creatinine greater than 1.1, and or doubling of the serum creatinine concentration in the absence of other kidney disease. Then finally, pulmonary edema. Finally, diagnosis of HELLP syndrome. The first thing that you're going to see is hemolysis. Hemolysis is the destruction of red blood cells, and that can be diagnosed in the following ways. A peripheral blood smear with schistocytes and Burr cells, a serum bilirubin greater than or equal to 1.2, low serum haptoglobin or LDH, lactate dehydrogenase, greater than 2 times the upper limit of normal, or severe anemia unrelated to blood loss, like the H&H hemoglobin and hematocrit can be low and there's no evidence of bleeding. You also need elevated liver enzymes, which means an AST or ALT greater than 2 times the upper limit of normal. And then finally, low platelets, less than 100,000. Now, one of the major differences between preeclampsia with and without severe features versus HELLP syndrome is that preeclampsia with and without severe features can be managed expectantly and does not always require an immediate delivery or prompt delivery, depending on the gestational age and how stable the patient is. However, HELLP syndrome requires delivery. If the patient's preterm, that typically means we try to get steroids on board to help with fetal lung maturity and then deliver. You don't sit on a patient with HELLP syndrome or expectantly manage them. So if you are being diagnosed with preeclampsia with or without severe features, or HELLP syndrome or eclampsia, you can ask, how was the diagnosis made? First question. Number 2, do I need to be delivered? If yes, when? If I need to be delivered, what's the best way and safest way to be delivered? Can I have a vaginal delivery, which most cases, even with HELLP syndrome, can be delivered vaginally. So obviously vaginal is preferred if possible, but sometimes cesarean section is better. So those are the main questions you need to ask if you get that diagnosis.